I want to talk today about the psoriasis treatments and the experience that we have about a multidisciplinary approach. We already know that pharmacological treatments are the keystone in the patient with psoriasis, but it happens, and it happens often, that not all patients achieve the goals that we are looking for. For this reason, it's important to have in mind that a different approach could improve these results, and probably these are located out of a pharmacological treatment. How could we improve the results? Probably with a team. So in our clinic, we are using a team of a nutritionist, a psychologist, a pharmacist, and a social worker. They want to improve all the other areas that are not related with the drugs or the medication that the patient are receiving for this disease. In those cases, just have in mind that a patient that had obesity or any other metabolic disorder, even though physical or psychological stress, could get worse of their psoriasis. That's the main reason we are thinking that this tip could help to improve the treatment. There's a relationship between the nutrition and the psychology of and the patient with psoriasis. What is that? It happens that many patients has increase in their body weight. And probably this is related because they increase their food intake. They don't have good habits with the food. Probably they don't have a really good compromise to change. They still continue eating whatever they got in their house, junk food, or something that is easy to eat, or even, and probably this is related because the patient that got obesity and got this metabolic disorder, or all the inflammation related with the food, will have worse symptoms because the psoriasis will get worse, and probably they will have also, because they feel fat, they feel with other lesions on the skin, the sensation that they have changed, they feel stigmatized, and even though it's related with reduced self-esteem. There's a psychological burden on all patients with psoriasis, and we already know that they have more depression, they have anxiety. In some patients, you don't find these symptoms because they have alexithymia, and these symptoms could be hidden from the physician, so you have to ask for it. And probably you will find that the patient got low self-esteem. How the psychologist intervention could help? For example, cognitive therapy will improve this kind of symptoms. It will help with the disease acceptance and probably will help reducing the anxiety. It's important as well, if the patient gets a psychiatric disorder, to recognize that one opportunely, to send the patient to a psychiatrist if it's necessary. And also it's important for us to understand that the patient needs to have self-acceptance of their condition. Nutritional habits is related with self-acceptance, probably because the patient who feel fat and don't feel pretty got low vanity, and they don't matter if they want to take care of their foods. Obviously, there's a reduced interest in this area, and unfortunately, patients with low income could be hard to find less good food for them, because they will find that the kind of food that is better for them is expensive. And sometimes it happens that there's like an idea that obesity is normal, it's part of self-acceptance, and we need to educate the patients against that. The nutritionist intervention will bring the patients good ideas to eat in a healthy way. Education about how obesity is a disease. Obviously, we need self-acceptance, but we need to change into a good health. motivational ideas about how to cook, which food you could get would be better for those patients. And obviously, it's important to have in mind the income that the patient has to adjust the food for these patients. The social worker will help to identify some issues that sometimes is under the radar. For example, the absence of support from the family, the low understanding of the disease in the society, and sometimes their parents, their siblings, even though their friends, they don't have any information about the disease. And it's important to recognize a support network that could help the patients. The intervention will be aimed to do that, increase the support network, educate the family about the disease, educate the patient as well, and improve the patient with their social skill and their social network to be better integrated to the society. The pharmacist's role sometimes is wide, and they have many points where they could improve the treatment. For example, reduces the expenses of the treatments, choosing the best therapy for each of them. Education on the patients to improve the therapy about how to use it, how to find any adverse events. They also will help to find short-term objectives, trying to find when the patient is failing, the best therapy for them. Also, they will help to schedule the visits in a good way because they will send reminders to tell them that they will help them. Sorry, I lost my idea of this slide. I will get my idea in another way. I will have it again.
No problem.
I will bring just 4 ideas, and I won't tell everything. The pharmacist's role sometimes is wide. They have to think about how to reduce expenses with the medication. Also, they have to educate the patients about the therapy, how to follow the instructions, or how to be alert about any adverse event. Also, they will implement short-term objectives for the therapy, and they will tell us if it's necessary to do any change. That is just part of the list of all the objectives of all the possibilities that the pharmacist could help us to improve the patient with psoriasis. But there's a specific question. Are these interventions really effective? I say it's easy to believe, but hard to prove. Why is that? All these interventions are logical, but sometimes it happens that those are hard to correlate with results. It's hard to find if you implement, for example, like a nutritional habit, it will help to reduce PASI or the LQA. Sometimes weight is measurable, but stress or disease burden is not that easy to measure, and that is part of the problem. Long-term objectives could be achievable, but it has been more correlated with pharmacological treatment more than with those interventions. For this reason, more studies are needed to know about these strategies to improve the patient with psoriasis. Thank you.